Okay, thank you very much to the amazing team from the Brain Tumor Foundation for inviting me to speak to you today. I am absolutely honored to be here today amongst brain tumor survivors and family members and caregivers, as well as other healthcare professionals, and I hope that my presentation is of value to you today. Next slide, disclosures. I do have a couple of disclosures in terms of speaking fees and advisory boards for a couple of pharmaceutical companies, Sanofi, Celgene, Roche, and Amgen. Otherwise, I feel like my true disclosure is my love of pharmacy. From grade 11 in high school, and I had come across an advertisement for a university, and one of the programs listed was pharmacy. I was intrigued. I had completed some job shadowing at a retail pharmacy as well as a hospital pharmacy near my hometown, and I was hooked. I knew that that was it. That was what I wanted to do. I wanted to work in healthcare, but I didn't want to touch people. I'm a little standoffish when it comes to blood and blood products. So, and I love math and pharmacy and science, so pharmacy really was a perfect fit for me. It included healthcare, looking after people, as well as math and science. All of it combined was really the perfect stop for me. The learning objectives that I've outlined, I like to work in threes. So we've got 3 learning objectives here. The first one is really outlining the role of the pharmacist and other members of the pharmacy, including pharmacy technicians, in the care of brain tumor patients. What are the standards of care for pharmacy in Canada? I also want to highlight the pharmacy that I work at. I work at the London Regional Cancer Program Pharmacy at London Health Sciences Centre in London, Ontario. And I want to talk about our role in terms of the care of cancer patients, specifically brain tumor patients, and our role within the hospital, our role within Cancer Care Ontario. My second objective is highlighting the safe use of chemotherapy in the home. Treatments are changing and evolving every day, and sometimes treatment is not given within a hospital or clinic setting. Sometimes treatment is given in the home, and how is that safely done? There are some important precautions to be aware of. I also want to speak to some common oral chemotherapy agents and supportive care medications that are used in the treatment of brain tumors. We'll do a little synopsis of the use of some of these medicines and the adverse effects. So, objective number 1. What is the role of the pharmacist and also your pharmacy in your treatment? So this is me, or at least how I imagine I look when I wake up in the morning and head to work. This is what I do, or at least part of it. So some of you may recognize some of the medicines that I've pictured here. So as a patient with a brain tumor often may be receiving oral chemotherapy treatment, may be receiving supportive treatment for side effects or for seizures. And this is really just a little snapshot of some of the medicines a patient may be on. And next. So, who is your pharmacist? Your pharmacist has a university degree. Myself, I graduated from the University of Manitoba. They may actually have 2 degrees, depending on their path towards pharmacy. They may have a general science degree first, and then apply to the pharmacy program and obtain their pharmacy degree. So there are different paths towards getting your pharmacy degree. After your degree is completed, there are practical rotations that are completed in retail pharmacies and hospital pharmacies, really throughout your training and after your training. And then there are provincial and national examinations on pharmacy practice, on the laws of pharmacy, and on the standards of care. And of course, after you graduate and you're licensed, there is still continuing education that is completed throughout your career in pharmacy, because things can change and evolve all the time. What different types of pharmacies are there? There is community pharmacy, maybe more commonly known as retail pharmacy or your drugstore. Those examples of that include obviously Shoppers Drug Mart, Rexall. There are independent pharmacies out there as well. And so that's your drugstore pharmacy around the corner from you that you can just walk into. There is a hospital pharmacy. And the larger hospitals, for instance, London Health Sciences Centre has more than one hospital pharmacy. So every hospital would have a main pharmacy, and the main pharmacy would be in charge of supplying medicines ordered for patients that are in the hospital, that are staying as an inpatient in the hospital. The larger hospitals do have what we call satellite pharmacies, which are smaller pharmacies located in specific wards or specific areas of the hospital. Examples would be the neonatal intensive care unit may have its own pharmacy. Pediatric intensive care unit may have its own pharmacy. Even the adult critical care unit could possibly have its own pharmacy. In our hospital, we do have a couple of satellite pharmacies, including really the one that I work in is a satellite pharmacy for the outpatient cancer population. And I'll delve a little bit more into our pharmacy later on in the presentation. Another pharmacy you may have heard of is an internet pharmacy. So this is a pharmacy that doesn't have a physical front shop that you would walk into as like a regular retail pharmacy, but it is a pharmacy that would likely receive prescriptions through the fax machine, or we're starting to delve into the online world now of prescriptions, and that's an evolving practice. And the internet pharmacy would then mail out or ship via a courier service the medicine to your home. And so it's a pharmacy you wouldn't necessarily meet face-to-face with the individuals, but may be dealing with them through the mail, through the telephone, through the fax machine. And then remote dispensing locations. And these are pharmacies that are usually in very remote areas of the north and not too common around here. Standards of practice. So, pharmacists and pharmacies are governed by each individual province. So, for example, in Ontario, the governing body is the Ontario College of Pharmacists. And I do have their website link at the end of my presentation. However, there is another organization called NAPRA. NAPRA is the National Association of Pharmacy Regulatory Authorities, and it really serves as a resource for each of the provinces. NAPRA is also a resource for the public about pharmacy regulation in Canada. It can establish standards of practice, harmonize the practice of pharmacy across provinces, and it's a national voice to domestic and international government agencies and other areas. The piece that I kind of want to really focus on is the standards of practice for pharmacists that are listed here. NAPRA, really their guidance is to the standards that they want pharmacists to uphold are to be experts in medications and medication use, helping pharmacists collaborate with one another and other healthcare professionals, helping pharmacists maintain safety and quality of their profession, and professionalism. So the Ontario College of Pharmacists is responsible for licensing pharmacists, and in the case of Ontario, also licensing pharmacy technicians. And the college, the Ontario College of Pharmacists, is responsible for safety of pharmaceutical care given to patients in Ontario, such that if, as a patient, if you feel you have not received the appropriate standard of care from your pharmacist, your pharmacy technician, or your pharmacy, you can contact the College of Pharmacists in your province and submit to them a complaint and let them know if you did not receive the standard of care, and it's up to the College of Pharmacists to investigate the situation and deal with it. So the College of Pharmacists in your province is really there to serve the patients of that province. It's important to remember that you can go to them if an issue arises that you think was not dealt with appropriately. So, the role of the pharmacist is really involved in patient care, providing care to patients, drug information, answering questions patients may have about their medicines, answering questions nurses or physicians or other healthcare providers may have about medications, as pharmacists are the medication experts. Pharmacists are involved in drug distribution. So what does that mean? That really involves when a pharmacist receives a prescription from a physician for a patient. Everything from reading the prescription, entering it into the software program to generate a label for the prescription bottle, evaluating whether or not that is the right drug, the right dose for the right patient at the right time, and ensuring that if all those parameters are met and that is the right medicine for that patient, that that medicine is filled appropriately and the right medicine, the right dose is within that prescription vial, is labeled correctly, and then is given to the patient. Pharmacists can also be involved in management of their particular area, management of staff potentially. Pharmacists are also involved in education, whether it's education to patients about their medication, the do's and don'ts of the medication, which I will get into in my next couple of slides. Pharmacists can also be involved in education to physicians about new medicines, educations to nursing staff about new medicines, and education to others as well. Dispensing of medication. So the pharmacist is responsible for reviewing each prescription for a medication that a patient is taking for the first time to ensure that this medication is the most appropriate for the specific patient and to ensure, one, there are no significant drug interactions or contraindications for that particular patient. Number two, the medicine is the most appropriate in view of the patient characteristics, other conditions or illnesses that patient may have, and other medications that the patient may be taking. The dose and instructions for use of the medication are correct. Now I want to talk about the Essential 10, and this is to do with counseling or patient education. When a pharmacist is educating a patient about a new medicine they've been prescribed, I've pulled up this Essential 10, and this really comes from the Ontario College of Pharmacists website, and I'll extrapolate on each of the points. So, in addition, of course, to dispensing the right drug to the right patient, the right dose, the right time, and the right route, the pharmacist is also involved in educating the patient. So, what should you know when you are prescribed a new medicine? Here we go. One, what is the name of the medicine and what is it used to treat? Number two, when should you take the medicine and how often are you taking the medicine? Is there a specific time of day that you're supposed to take this medicine? Is it taken once a day? Is it taken twice a day? And if it's taken more than once a day, how far apart should it be taken? Does it matter? Sometimes it does. Sometimes there's room for give and take. Number 3, how long should you be taking your medicine? Is it something you're taking every day until your physician tells you to stop? Is it something you're taking for a week? So it's vital to know how long you're taking it. And in terms of relating it to, for instance, oral chemotherapy that a patient with a brain tumor may be taking, the medicine may only be taken for 5 days in a row, and then the patient has 23 days off. And then they take the medicine again for another 5 days in a row, and then they have another 23 days off. Sometimes the medicine is taken every day. Sometimes the medicine, the oral chemotherapy, may be taken in relation to their radiation treatment. So may be taken every day before the radiation treatment. So there are a lot of variables in there. So it's important to know exactly how long you should be taking this medicine. Number 4, what should you do if you forget to take the medicine? And this may depend on when you realize you forgot that you take it. You don't necessarily double up and take extra the next time. Every medicine sort of has a unique use, and it's important to know if you don't find that out right away, call your pharmacist when you do realize you forgot to take a medicine, and then find out what to do. Number 5, when will you notice the medicine working, or will you even notice it working? For example, the outcome of taking the medicine. Sometimes you may not feel the medicine working, and that doesn't mean that it isn't. For example, patients taking blood pressure pills. Often you don't feel when you have high blood pressure. So taking the medicine doesn't mean that you're going to feel any differently. And even in the case of oral chemotherapy for a brain tumor, you may not necessarily feel any different, but your physician and your healthcare team will be monitoring your progress, and they may be involved in looking at CT scans, etc., to determine if the medicine is working for you. Number 6, are there any special instructions for taking the medicine? Should it be taken with food or on an empty stomach? Is there anything specific in that respect? That's important to find out. Sometimes taking medicine with food can affect how the medicine is absorbed by your body. So sometimes it's very important to take the medicine with food, or sometimes it's the opposite, and it's important to take the medicine on an empty stomach, which usually means an hour before or 2 hours after. There are some medicines that can interact with items such as calcium, magnesium, iron. So if that's the case for your medicine, you may not be able to take it at the same time as any of those products, or even a multivitamin, because those often contain calcium, magnesium, and iron as well. Number 7, what side effects can occur while taking this medicine, and how you can recognize the warning signs of certain side effects or dangerous side effects. So we all know often taking medicines involves the medicine helping you in one respect with your health, but sometimes can cause side effects. Sometimes the side effects can be mild and not too bothersome. Other times they can be very bothersome. Sometimes the side effect can be there when you first start taking a medicine, and then it can go away. Other times, side effects can increase over time. And recognizing and knowing what to do if you experience a side effect is vital. Very rarely, medicines can sometimes cause side effects that necessitate stopping taking the medicine. So your pharmacist should provide you with information, verbally and written, of course, that can outline what the common, uncommon, and rare side effects are. If you experience one of those side effects, what you should do. It's very important. And if you don't have that information and you feel like you're experiencing a side effect from a new medicine, contact your pharmacist or contact your healthcare team and let them know, and so that they can determine whether or not you can continue taking the medicine or need to change something. When in doubt, find out. Don't just let it go. It's very important to address the issue so it doesn't get worse by continuing to take a medicine that maybe is causing a severe side effect. Also goes along really with number 8, what to do if you experience any problems in taking the medicine. Number 9, becoming more and more vital every day, is how to store the medication. Most of the times it's stored in a dry, cool, dark place. That's sort of the usual tagline with many medicines, but more and more often we're dispensing medicines to patients that maybe need to be refrigerated. So it's important to know, and that even goes for oral treatments. We have some tablets and capsules specific to oncology that are used for the treatment of other cancers that are stored in the refrigerator, which is a bit unusual and unexpected, but it can happen, as well as the medication container that the medicine is provided in. There are a few medicines now that need to be dispensed in the original container from the manufacturer because it has a special desiccant in it, and those medicines are very sensitive to moisture, even the moisture in the air. So if that is the case for you and the medicine is dispensed in the original container, sometimes you will see a desiccant. A desiccant is like that little silica packet that you sometimes get in clothing. It's like a little square packet. In medicines, it can sometimes look like that. Sometimes it's more of a round plastic desiccant, and that desiccant is responsible for absorbing moisture in the air around the medicine. And it can be crucial for some medicines are very sensitive to moisture in the air. So if your medicine bottle comes with one of those desiccants in it, keep it in it. Do not throw it out. It needs to have that desiccant in it. So storage can be variable depending on your medicine. Also, if your pharmacist doesn't give it to you right away, which they should, you should get detailed written information on your medication. Otherwise, if you don't and you are looking for medication, obviously you can contact your pharmacist. In terms of medicines used in the treatment of cancer, there are 2 great patient education websites. I believe I have them listed at the end, but if I don't, they are Cancer, and I do have them listed at the end. One is Cancer Care Ontario. They have patient information specific to medicines used in cancer treatment, as well as BC Cancer. And I do have both websites listed at the end of the presentation. So, in addition to your pharmacist dispensing your medicine, counseling or providing patient education on your medicine, the pharmacy can also be very involved in helping people access medicine when funding is an issue. Every province is different in terms of funding of medicines for patients of the specific province. There are specific rules and different funding pathways. For example, in Ontario, if you are 65 years and older, there is drug coverage available to you. There's a formulary, which is a list of medicines that are covered in the province of Ontario. In Ontario, if you're on social assistance or disability, you also have coverage through that. If a home care nurse issues you a drug card, you have coverage that way as well. And in Ontario, you can apply for Trillium drug coverage. In addition, there is private drug coverage through your employer, for instance. However, there still are potentially gaps in coverage of medicines, especially new medicines. New medicines often may not have coverage by your government drug plan or your private health plan. And our pharmacy in the cancer program, and every cancer program that I'm aware of, employs the use of drug access facilitators. Drug access facilitators often have a background in pharmacy. Often they're pharmacy technicians, not always. Sometimes they're social workers or nurses as well. And they are experts in determining financial coverage for a medicine for a patient and finding coverage options, whether it's through government funding, whether it's through a private drug plan, or whether it's through a patient assistance program. And I believe there was another session today that looked at patient assistance programs. Your pharmacist is also responsible for looking at drug interactions and answering drug information questions from your healthcare team. All right, so moving on to my place of practice. This is the London Regional Cancer Program within London Health Sciences Centre in London, Ontario. This is the second level entrance. So when you enter in the store, you're on the second level. There is another entrance around the corner and down a ramp, and that is the first level entrance near the radiation area. The first level, level 1 of the London Regional Cancer Program, is primarily devoted to radiation therapy. The second level, as it is right now, is devoted to chemotherapy treatment clinics. Our pharmacy is on that level, as well as a couple of other things like labs. All right. So, as an LRCP pharmacist, here I am again. Just woke up and I look like this. So what is my role within the cancer program? My role is different every day, which is fantastic. We have two sides to our pharmacy. We have the retail side, similar to, but much smaller than your regular drugstore, and we don't have any front shops, so we don't sell anything over the counter. We only fill prescriptions. And of those prescriptions, primarily they are for anti-cancer medicine, oral chemotherapy, targeted therapy, hormonal treatments, and other treatments. And we also fill medicine for supportive care. For instance, medicine used to treat pain, diarrhea, constipation, low blood counts. There's also other medicine used to treat the side effects of the anti-cancer medicine, as we discussed before. There used to be very few oral chemotherapy treatments or take-home treatments for cancer. Majority of treatments were done within the clinic or within the hospital as intravenous treatments. But over the last few years, the number of medicines given orally and taken at home has increased dramatically. It has really skyrocketed. These medicines can be very expensive. And most of your regular community or retail pharmacies do not stock these new, unique, expensive anti-cancer treatments. Or they may not be willing to stock them because of the cost of them. So we're in a unique position, our pharmacy at LRCP, in that we do carry all these medicines, obviously. This is what we specialize in. So most of the patients that see physicians at the London Regional Cancer Program will come to our pharmacy to receive their cancer-related medicine. The other side of our pharmacy is what we kind of call our intravenous side. And our pharmacy is responsible for preparing chemotherapy that is being given to patients within the cancer program in our chemo suite. So our chemo suite is an area of chairs and beds where patients coming in for day treatment of their cancer come in to receive intravenous chemotherapy treatment. They're not staying overnight. It's an outpatient ambulatory area. They're coming in maybe once a week to get an IV chemo treatment, every 2 weeks, every 3 weeks, or every month, or anywhere in between. And the pharmacists are responsible for assessing every oral chemotherapy and every intravenous chemotherapy order for appropriateness, the right dose, the right frequency, the laboratory parameters are met, and many other factors. Our cancer program is also very actively involved in research. We dispense research or study medicine as well. And study medicine may be intravenous, it may be oral, but we're very involved in that. The pharmacists counsel patients on their therapies and their supportive care, and we collaborate with the physicians, nurses, dietitians within the cancer program on a daily basis about the care of our patients. Pharmacists often attend rounds with physicians and nurses and other healthcare professionals. Our pharmacy technicians specialize in the preparation of our intravenous and oral medicines. And we all assist our patients in accessing the medicines that they may need. So, moving on to objective number 2, safe use of chemotherapy in the home. What I'm displaying here are 2 pamphlets that are available through the London Regional Cancer Program website, and I have the link at the back at the end of the program. So why is there a concern about handling of chemotherapy? The preparation of chemotherapy has evolved immensely over the years. From the very beginning days of nurses on patients' floors preparing chemotherapy, now to the development of very strict NIOSH standards, of strict sterile preparation requirements to protect the sterility of the product and minimize exposure to the pharmacy technician preparing the product. Why is this important? Well, anti-cancer medicine can be harmful to others. We know that it can be beneficial to patients with cancer, and that's why we give it. But chemotherapy does have the potential to cause cancer. It can have the potential to harm a developing fetus. It can have the potential to affect reproduction in individuals. And while there is always a balance between the healthcare team and the patient with cancer in determining the right anti-cancer treatment for them, we know that the anti-cancer treatment could potentially cause harm. And there's always that balance, risk versus benefit to that patient. But a patient's caregiver at home may potentially be exposed to the chemotherapy treatment as well, and they don't have cancer. So we want to make the best effort possible to minimize exposure of the caregiver at home to the chemotherapy treatment their family member may be receiving. We don't know if there's a safe level of exposure to treatment. So if a caregiver is handling their family member's chemotherapy treatment, are they getting exposed to the treatment? How much are they getting exposed to? Is it safe? These are things that we don't know. So how we practice is doing the best we possibly can to minimize exposure to the caregiver from the chemotherapy medicine. So I do have the links to these brochures that you will be able to review. I will highlight a few items from each of the brochures. So first off, oral chemotherapy at the home. How to handle the medicine. Patients handling their own medicine should wash their hands with soap and water afterwards. If a caregiver is handling the medicine instead of the patient, ideally, the caregiver should wear gloves to handle the medicine, and they should also wash their hands afterwards to minimize exposure to them. Oral chemotherapy should not be crushed, broken, or chewed, and oral capsules should not be opened, except when specifically instructed to do so by the pharmacist. Every effort is made to avoid splitting tablets or crushing pills or opening capsules at home due to the risk of exposure of the medicine to others and potentially for other reasons as well. Depending on the nature of the medicine itself, it may not be amenable to being crushed or split. However, there may be situations where patients are instructed to manipulate their medicine to get the right dose. It should not ever be done unless you're instructed to do so by your pharmacist. We do detail out specific instructions on how to split pills, how to crush pills, how to dissolve them in liquid, as well as how to clean up any spills that may occur, and that will be in those brochures. But again, shouldn't be done unless specifically instructed by your pharmacist for your medicine. Any unused medicine should be returned to your pharmacy for proper disposal. Do not flush it down the toilet. Don't throw it in the garbage. Any unused, expired medicine, bring it to your pharmacy for proper and safe disposal. Okay, second brochure, safe use of chemotherapy in the home. I just am highlighting a few of the common questions we may get. First off, what should I do when I go to the bathroom? You may use the toilet as you normally would. However, for the first 2 days or 48 hours after receiving chemo, you should flush the toilet twice with the lid closed. This is to make certain that there's nothing left in the toilet. Sharing the bathroom with your family is safe as long as if there's any urine or stool, it's cleaned up. Wash your hands with soap and water afterwards, and wash your skin, obviously, if anything gets on it. Can I put chemotherapy waste in the garbage? No, absolutely not. Chemotherapy waste is potentially hazardous and needs specialized handling, and you should receive instructions on that from your pharmacy. We tell all of our patients to return their unused chemotherapy medicine to our pharmacy. Is it safe for family members to have contact with me during chemotherapy? Absolutely. Eating together, enjoying your favorite activities, hugging, they're all safe to do. Is it safe to have sex during my treatment? Being sexually active is safe, but care needs to be taken. Traces of chemotherapy may be present in vaginal fluid and semen. A condom must be used. It is also possible to become pregnant or to father a child while receiving chemotherapy. It is vital to use a reliable birth control method, for example, a condom, while you're receiving chemotherapy. It is very important if you are initiating chemotherapy to talk specifically with your healthcare team, your physician, your nurse, about being sexually active while you are on treatment and about safe precautions. Moving on to objective number 3, looking at a few of the common oral chemotherapy and supportive care medicines used in patients with brain tumors. So I'm highlighting a few of the common treatments that we see for brain tumor patients. This information is also available on Cancer Care Ontario website, BC Cancer website as well. One of the first medicines that we commonly dispense at our pharmacy for brain tumor patients is Lomustine, otherwise known as CCNU. It comes in 3 different capsule strengths. The dose of this medicine is not a one-size-fits-all, like a blood pressure pill, for instance. The dose of this medicine is tailored based on your height and your weight, and using a combination of these 3 capsules to get the dose best for the patient. This medicine is usually just taken once. A single dose is taken usually once, approximately every 6 weeks for our usual protocols. How is this medicine monitored? The effect of the medicine can't necessarily be felt, whether or not it's helping your brain tumor. However, it's often followed up with scans. Of course, depending if your brain tumor was causing specific symptoms such as seizures, there's a potential for seeing a difference there, but generally follow-up scans is how your physician will monitor your treatment. This medicine is taken on an empty stomach. The reason for that primarily is that sometimes it can cause nausea and vomiting, and that is lessened if it is taken on an empty stomach. Quite often our physicians recommend taking this particular medicine in the evening before bed. Nausea, vomiting can occur as one of the side effects from this medicine. So often anti-nausea medicine is prescribed to patients to help prevent or treat any nausea or vomiting that can occur. In terms of side effects, this medicine can affect blood cells. It can affect white blood cells, it can affect red blood cells, it can affect platelets. So if it lowers any of those types of cells, it can cause the risk for example, lowering white blood cells. That can put an individual's immune system weakened. A weakened immune system could cause an individual to be more susceptible to an infection. Infections, when it's present, often is accompanied by fever, chills. So that is the white blood cells. Affecting platelets or red blood cells could lead potentially to unusual bleeding or bruising because there are insufficient platelets to stop bleeding. This medicine is stored at room temperature. So those are just a few of the highlights. More specific and detailed information is available on the websites I mentioned. Another common medicine, oral chemotherapy, that we administer at our pharmacy or dispense at our pharmacy is Temozolomide. The other name you may hear for Temozolomide is the manufacturer's brand name Temodal. There are several different dosing protocols for Temozolomide. It can be used in combination with radiation. It can be used without radiation for 5 days every month. It can be used every day continuously, and the dose of each of those different scenarios is different. This medicine also comes in several different dosage forms, and each of those capsules has a unique size, shape, and color to it. Comes in a 5 milligram, a 20 milligram, a 100 milligram, 140 milligram, and a 250 milligram capsule. So the dose is based on the patient's height and their weight. And based on that information, the calculated dose is then given as a combination of one or more of these capsules to give the right dose to the patient. That dose may change if your weight changes. And physicians will follow up, and in follow-up appointments will reweigh patients to determine if this is still the appropriate dose for them, or if they've gained or lost weight and need to change the dose. We also recommend this dose, that temozolomide, be given on an empty stomach. Again, it's a similar reason to the Lomustine in that individuals can have trouble with nausea or vomiting with this medicine, and that can occur. So we usually give anti-nausea medicine sometimes before each dose of the temozolomide, sometimes just on an as-needed basis. Every situation is unique, but anti-nausea medicine should be available to you if you need it. In terms of highlighting just a few of the other side effects, other than nausea and vomiting, is, again, this is a medicine that can affect our blood counts. The white blood cell counts, in lowering those, can increase your susceptibility to infection due to a weakened immune system. So there's the fever, chills, infection. This medicine can also affect platelets, which could lead to trouble with clotting, bleeding, which can lead to bleeding or bruising. Hair loss is another potential side effect with temozolomide. This medicine is stored at room temperature, in a dark, dry place in the original containers that the pharmacy provides you. Another medicine that is used in the treatment of brain tumors is Procarbazine, or Matulin is the brand name for this medicine. There are several different dosing protocols with this. It only comes as one strength, a 50 milligram capsule. Your dose may be more than one capsule at a time though. Again, the dosing is based on your height and your weight, and there are a variety of different dosing protocols out there. This medicine can be used alone or in combination with other medicines as well. Follow-up scans, again, is usually the routine standard when a physician is monitoring a brain tumor. This medicine, the Procarbazine, does have some specific restrictions in terms of food restrictions and avoidance of alcohol. Without getting into it too deeply, it relates to something called tyramine. Tyramine is a component of some foods and alcohol. It's present often in dried meats, dried smoked seasoned meats, and aged cheeses. So there is a whole specific list of foods that need to be avoided or minimized while on this medicine, and that is to avoid feeling very ill side effects. And alcohol has to be avoided. And BC Cancer and Cancer Care Ontario will list specifically what foods need to be avoided. Nausea and vomiting can also occur with this medicine, as well as it can affect the blood counts as the previous two that I referred to. This medicine can also carry with it the potential for drug interactions. So it's important for your physician and pharmacist to review the other medicines you are on to determine if there are any drug interactions with this, as with any other medicine. However, this one just has a potential for more drug interactions. Moving on now to a couple of supportive care medicines that are used in patients with brain tumors. First off is Dexamethasone. Dexamethasone, also known by its old brand name of Decadron, or called the steroid at our center, because when you see the shape and the look of it, it's a little white five-sided pentagon tablet. We have patients that call it the star, they call it the house, they call it the pentagon, they've called it the Chrysler tablet, so it goes by lots of different names. Dexamethasone is used in a variety of different dosing protocols. It has many different uses. It has a lot of uses. It's used as anti-nausea medicine. It's used to reduce swelling or inflammation as an anti-inflammatory medicine. It can be used as part of chemotherapy treatment protocols as well. So there are many, many uses and doses of dexamethasone. It comes in a variety of strengths, the dexamethasone. So there's 0.5 milligram, 1 milligram, 2 milligram, 4 milligram. So there are a variety of different dosing tablets available. Dexamethasone, by nature of it being a corticosteroid, is similar to the corticosteroids that our body produces on its own. Corticosteroids have a variety of uses in the body, and your body produces them. When an individual starts taking dexamethasone, there's a signal that goes to the body that says, I'm getting a corticosteroid by mouth. I probably don't need to make as much corticosteroid on my own. So your body can adjust its own production of corticosteroids because you're taking it in a tablet form. So for that reason, we get concerned about something called withdrawal. If you have been taking dexamethasone for 10 to 14 days or longer, your body has become used to the medicine. And if you were to stop taking the dexamethasone suddenly, like stop it cold turkey for instance, your body may have some side effects. Your body may have some withdrawal type side effects where you feel anxious and ill and just generally unwell. So if you've been on dexamethasone for 10 to 14 days or longer, often your physician will have to taper your dose down slowly. Doesn't mean you're on dexamethasone forever. If your physician feels that you may not need to take the medicine anymore or that you can slowly start weaning it, they will slowly taper the dose down. So it's important to be aware of that with this particular medicine. We recommend dexamethasone be taken with food if possible, because if it's taken on an empty stomach, often individuals experience heartburn. So with food, even a little snack is a good idea. Dexamethasone can increase our energy level, so it can lead to trouble sleeping if it's taken too late in the day. It can cause an increased appetite, which sometimes is a good thing. And there are the potential for long-term side effects if you're on dexamethasone for a long time. Storage of medicine. This is generally stored at room temperature. All right. The next group of medicines I want to talk about are a couple of anti-nausea medicines. One is called Ondansetron and the other is called Granisetron. Ondansetron, the brand name for that one is Zofran. Granisetron, the brand name for that one is Kytrol. These medicines are often used to prevent or treat nausea and vomiting. There are many different dosing protocols. They're often used in combination with chemotherapy treatments. Whether the chemotherapy is intravenous or whether it's oral, these medicines can be used with those treatments to help prevent nausea and vomiting. They're taken with or without food, it really doesn't matter. In terms of side effects, probably the most common that we hear of from patients is the potential for a headache or constipation. Constipation can especially be an issue if these medicines are taken regularly on a daily basis. So we often try to have patients only take the medicine when they really need to take it. So there may be specific days of their chemotherapy protocol where we want patients to take these medicines on a regular basis. And then after a certain period of time, we may have them stop taking them until the next cycle of their chemotherapy protocol. But every situation is unique, and it really depends on the chemotherapy protocol that you are on as to how often and how long you should be taking your anti-nausea medicine. So it's really specific to your chemo protocol, and that's something, if you're unaware of how long to take it, again, go back to your pharmacist, go back to your healthcare team to determine when you need to take it. With these medicines, if the medicine is taken and a patient unfortunately vomits within 1 hour of taking it, we would recommend taking a second dose. These medicines are generally stored at room temperature. So, as promised, these are the references and resources that I used in preparing this presentation and that really I use on a daily basis in my practice. BC Cancer, Cancer Care Ontario, OCP Info refers to the Ontario College of Pharmacists, NAPRA, and the website link for the London Regional Cancer Program within London Health Sciences Centre is also listed here, and that is where the 2 brochures on oral chemotherapy and safe use of chemotherapy in the home will be located. So a few final thoughts. Your pharmacist and pharmacy are medication experts. When you have a question about medications, ask them. It's important to be aware of medication, especially chemotherapy medication use in the home. What special precautions you need to take. For example, is a caregiver handling a medicine for you? What precautions should they take? Gloves and other measures may be necessary. When in doubt, ask. It's also important to use trusted information sources on anti-cancer treatment. We all know the internet is full of helpful information, but it's really important to go back to trusted sources of information on anti-cancer treatment. So in final closing, thank you very much to the Brain Tumor Foundation for inviting me here to speak with you today. It's been truly inspiring listening to the other speakers, speaking with members at my table, speaking with patients, speaking with caregivers, speaking with other healthcare professionals that work with patients with brain tumors. It has been a very exciting day. I'm very pleased that I was able to be part of it, and I thank you very much for your time and attention. If you have any specific questions, please feel free to contact me at this email address listed. Thank you.